Now, health experts say they are concerned Ontario's decision to lift COVID-19 isolation rules will result in an eighth wave. The province announced on Wednesday those who test positive will be able to return to work or school once symptoms have been improving for 24 hours. Health experts are urging people to remain cautious, warning the virus can remain infectious for at least 10 days after symptoms clear. The Ontario Teachers' Federation say they are also concerned the move will cause the virus to spread faster in schools. And let's now bring in Dr. Steve Flindall, ER doctor. Dr. Flindall, thank you for your time.
Thank you, Akshay.
Your reaction to what we heard on Wednesday about these new guidelines, protocols around isolation. Where are you on that?
I just in disbelief. I can't believe that we've dropped just about every protection we have against COVID.
What will this result in, Doctor?
Oh, undoubtedly it's going to result in more illness. There's going to be more absence from work. There's going to be more ill children. The already strained emergency departments are going to face more patients and more staff illness and absence as a result.
You know, we've been speaking to experts such as you almost on a daily basis since the start of the pandemic, and we've sort of understood that how this virus works in terms of infecting others if an individual is positive. Do you wonder, are you surprised, has there been any conversation with Dr. Kiran Moore and his team on why and on what basis was this decision taken?
I can't understand how they based this decision. It's clearly not from a medical or scientific standpoint. There seems to be distinct political pressure being applied to this, and I can only surmise that they think this is going to benefit the economy somehow, but I think ultimately it's going to backfire.
Because it may lead to another wave altogether. So we know, Doctor, that hospitals across Ontario are under strain. We've been talking about how emergency rooms have been closing down because of nursing shortages. On the other hand, we know that, of course, schools are also reopening. But there is a booster shot available, yes. But all of this, what will this do to COVID-19 and the spread of the virus?
Well, the chief medical officer keeps referring to our strong vaccination program. In fact, it's been pretty dismal. Initially, we had good uptake. A lot of people got their first 2 shots quickly, but we're seeing that the first 2 shots are no longer good enough. You really need a booster. And if you look at the numbers for boosters of school-aged children, about 1 in 1,000 children between the ages of 5 and 12 have got a booster. None younger than 5, of course, have had a booster or even their second shot. And then the 12 to 17-year-old group has only 20% uptake of boosters. So they're really unprotected. Plus, we've dropped mask mandates, which,
yes,
tell me how possibly keeping masks in place in schools is going to be bad for kids. And when it's really a minimal effort and one of the only benefits we have, protections we have to give to our children.
Dr. Flindall, I'm going to create a scenario for you and paint us a picture of what may happen. Let's just say if there is a workplace and there are people who do end up testing positive. Now, according to the guideline, once the symptoms are better, they can still go into work. And the problem with viruses, as you and I know, we've been talking about it, that people still remain infectious even though symptoms disappear. In your understanding, what's going to happen at workplaces?
Oh, it's going to explode. You've got people under-vaccinated, not wearing masks, being exposed to highly infectious people. I mean, where is the possible best scenario in that? It's going to, of course, increase infections.
And what happens to people who are going to go now not go into work? There are going to be more sick days, you feel, if people are falling sick? And then what happens to staffing shortages?
Yeah, this is the problem. I think this is a very myopic view of relaxing the guidelines. People are going to go in sick. They're going to be pressured to go in sick by their employers. The Ford government has not really moved forward on paid sick days. So people, if they're being pressured by their boss to go back, of course they're going to go back. It's their livelihood. But they're going to go back and reinfect, maybe 2 other people. So this is going to grow exponentially in every workplace that has a worker return prematurely.
Okay, so you expect this to be a challenging fall where the pandemic is concerned. Dr. Flindall, we appreciate your time and your expertise. Thank you for joining us.
Thank you.